What we developed is a trial in patients that were tolerant to sorafenib and would present progression under sorafenib. And this selected a group of patients with preserved liver function, preserved physical status, and the trial was designed, I would say, very carefully so that we would have both arms very well balanced. And for this, the instrumental thing was to stratify the patients prior to randomization into active arm with regorafenib at the usual dose that is approved for colorectal or GIST, that is 160 milligrams a day, 4 weeks in, 2 weeks off, versus placebo. So the stratification factors were quite larger as compared to prior trials. We stratified Asia versus rest of the world, because frequently in Asia patients reach trials at a more advanced stage. Also according to symptoms, performance status 0 versus 1, presence of vascular invasion detected by radiology, yes versus no, presence of extrahepatic spread, yes versus no, and finally increased AFP beyond 400 as compared to AFP below 400. And this is important because AFP that is increased beyond this point is known to have a poorer prognosis. So with this, we randomized the patients, and the main endpoint of the trial was survival. And it was that way because it's the only robust endpoint that one can have for a phase 3 trial. Progression-free survival is less robust, is vulnerable, and we had this as a secondary endpoint together with time to progression, disease control rate, and quality of life. The survival was significantly improved with a hazard ratio that is 0.63, meaning that there is an improvement in the likelihood to be alive that is almost increased by 40%. Perfect. And this came together with a delay in tumor progression and obviously an improvement in progression-free survival. So everything was in the positive direction, not only in the endpoints in total, but also when we look to subgroups. All the subgroups we have analyzed, gender, race, etiology, location, the extent of the disease, they have a positive trend when we do the subgroup analysis. So the drug is active, efficacious, and provides a clinically meaningful improvement in survival.